Mental health professionals are this morning sounding the alarm on misinformation spread through social media. A new study from The Guardian finding that more than half of the top trending TikTok videos offer misleading mental health advice.
To break it all down, we're going to bring in now psychologist Sandy Ray from Brisbane. Good morning to you,
Hey,
Sandy.
Sandy.
Great to have you in on this today. It's a hot topic, isn't it? These videos are dealing with really serious matters like trauma, anxiety, depression. So what exactly is going on here? Set the scene for us.
Look, I think there's a real place, what we call lived experience. You know, there's no doubt that what you've experienced, what you share with other people has a place in mental health, and that's wonderful. But these TikTokers, of course, have very limited professional knowledge or training, and that's the risk that is running here. You know, you go onto TikTok because it's accessible, it's speedy, you don't have to make appointments, you don't have to save money to go and see a psychologist or a psychiatrist or a trained mental health professional. So all those are very attractive features, but it is only experiential knowledge. So, you know, you might have acne and you might have created some solution for your pimples. That doesn't mean to say you're an expert and call yourself a skin specialist. And so, of course, all these people who are doing their TikTok platforms are not identifying the nuance, the expertise that is needed in understanding the complexity of trauma, depression, anxiety, to name just a few.
And, you know, there are a lot of professional doctors on social media as well giving better advice. But this other advice, though, how dangerous is it to have inaccurate mental health advice?
Well, the most obvious answer to that, David, is why do you think it takes 6 years to train, as a minimum of 6 years to train as a psychologist? You know, 6 years, 9 years, 12 years to be a psychiatrist. It's a very in-depth requirement that you have critical thinking skills, that you understand what peer review assessments and articles are, that you understand evidence-based research. So these are the reasons that we train, that we are absolutely diligent in continuing our professional education, rather than just, I experienced depression, therefore I'm an expert.
Yeah, so what has led to this huge amount of mental health misinformation being able to spread on social media?
I think one of the really outstanding reasons is that people aren't information literate, and that means they don't understand both their own vulnerability, and I think this is an important point I probably should have talked about earlier on. People are very vulnerable. They want access to information very quickly. They don't understand how to read qualifications. I think we talked about this the other week on plastic surgeons. You know, even just like yesterday, I was looking at some beauty site, and there was an acupuncturist who was a nurse, whatever her name was, and she had doctor in front of her name, RN. And I went, that's curious. Why is Dr. so-and-so RN? Acupuncturist. So I looked it up, and I researched that you have to be a member of the Chinese board, which she didn't disclose. You have to declare what that doctor title means, and she hadn't declared it. But at first glance, Dr. so-and-so. There we go. That looks impressive. So it's about having information literacy and understanding what it is your own vulnerability is, what you need, what you look for, and what is the experience, actually being really critical in thinking, what is the experience and training of this person who's perhaps pretending, or extending, shall I say, not rather than pretending, they're extending their knowledge base or their level of expertise.
I think the most important thing is that if you do see something on your algorithm which reflects in your life, then use that to get some medical help and go seek some help indeed.
Absolutely, and I just quickly say, you know, you don't go to a GP now. You are going to a GP hoping that they've been to medical school. It doesn't, you know, we need to understand that there's training behind it all.
That is true, Sandy. You're always right.